MF is 60-year-old Caucasian female, present at clinic on October 26 at 10:20 a.m. to discuss about diabetes and lab result follow-up. For a history of present illness, she has diabetes since 2006. She has pain that has onset 5 years ago after surgery, location in lumbar area, and essential hypertension. For past medical history, she has solectomy on April 2006, and she has post-solectomy pain from that, and she has muscle spasm in spine and rib. She has abnormal result with liver function, low cholesterol, excessive sweat, frequent urination. For family history, father has cancer, diabetes, also arthritis, low cholesterol. Mother has had heart cancer, stroke, passed away from COPD, smoked for 20 years. For her social history, she occasionally drink alcohol, very rarely, smoked 1 ppd for 40 years, has tried to stop smoking, and she go to bed really early, wake up 3 or 4 o'clock in the morning. Her diet, and she did quit rice, eating potato, pasta, smoothies, lots of vegetables, and she doesn't take any no breakfast or no high carb or no sweet. She is currently single and does not have children. For her caffeine, she drinks 16 ounces per week of soda. Her highest education is 1 year in college. She is not employed. She is financially comfortable. She doesn't do any recreational drugs, and she is not sexually active. For her immunization history, she does flu vaccine every year. Last one on September 2011. For her libido system, she feels fatigue and she has excessive sweats. She doesn't have any cough, dyspnea, wheezing, no chest pain, irregular heartbeat, no bone joint symptoms and weakness, and patient is postmenopausal. For her vital, height is 5'2", weight is 152 pounds, blood pressure 108/72, heart rate 106, respiratory rate 16. IBW is 54.6 kg, BMI 27.78, which is considered as overweight, and B is 1398 kilocalorie per day. Patient is well nourished, very alert and oriented, no hearing vision limitation, no physical assessment needed. For physical exam from October 14, 2011, most of them look fine except the glucose is high, 316, and lipid panel and everything looks good. And again, the blood pressure is 108/72, which is under normal range, which is classified as normal range. For her allergy, there's no allergy known. For her medication, she's taking for hypertension, she's taking lisinopril hydrochlorothiazide 20/25, 1 tab POQD, and she's taking it for 1.5 year. For diabetes, she's taking metformin. For muscle relaxants, she's taking Flexeril, and also triamcinolone acetate. And for the over-the-counter medication, she's taking aspirin for pain, and also Aleve for pain, which she takes it really occasionally. She takes Mucinex every day for lung, and also Volatadine, and she's very compliant with her medication, she claims. For risk factor, according to JNC 7, for hypertension, risk factor will be age, and be overweight, obese, lack of exercise, smoking, too much salt in diet, too much alcohol consumption, stress, ethnicity, family history, and diabetes, cocaine abuse, hypercholesteremia, and low HDL. And for this patient, she has age over 55 years old, her weight, overweight, and smoking and diabetes. This for this patient, the treatment is needed. Patient should continue to be treated for hypertension because this chronic hypertension is well controlled ever since she started this medication 1.5 years ago. And also the patient possesses couple risk factors such as age more than 55 years old, overweight, smoking, and diabetes. For evaluating her medication, she's been taking lisinopril hydrochlorothiazide. This medication is appropriate according to JNC7. ACE inhibitor is the first line therapy for an important component of most regimens to control blood pressure with diabetes. It may be used alone, but are much more effective when combined with thiazide diuretic. Current dose of 20/25 is appropriate and effective that it has been route controlling the blood pressure, and the route of administration of PO is preferred route. Interval and frequency of the once daily is appropriate. And for the signs and symptoms, there's muscle spasm, fatigue, frequent urination, excessive sweating may be due to this medication. And there is no other hypertension medication used for this patient. For therapeutic alternative, there is angiotensin receptor blockers. Is also first line according to first line therapy with patient with diabetes and hypertension according to JNC7. It can improve cardiac mortality and microvascular complications. There's a beta blocker also beneficial to diabetics as part of multi-drug therapy, but their value as monotherapy is less clear according to JNC7. There is a calcium channel blocker may be used for diabetic particularly as part of combination therapy to control blood pressure. According to JNC7, they reduce CVD events in diabetic. And there is an aldosterone antagonist not appropriate for this patient, not for the patient with diabetes and hypertension, according to JNC7. For current medication, we found triamcinolone and loratadine has no therapeutic indication, and there's no indication found between her current regimen that has an interaction between the medications. For recommendation, we recommend her to continue the same therapy for hypertension as it is well treated and with current regimen. That she has blood pressure of 108/75, and also for the medication reconciliation, discontinue loratadine 10 mg and also triamcinolone acetate because there is no therapeutic indication. For the drug she's taking, try to avoid. Oh no, there's a drug that cause or have interaction with this medication. It would be alcohol, amphetamine, ecstasy, cocaine, corticosteroids, cyclosporine, potassium supplements, potassium sparing diuretic, estrogen, digoxin, NSAIDs, cough, and cold and asthma medication. Recommended tests would be daily blood pressure monitoring, blood test for BUN, serum creatinine, and urine output for renal function, monitor electrolyte, and also monitor weight. Goal of the therapy would be to prevent the development of the further and long-term chronic cardiovascular complication, and to lower the risk of the deaths, and to lower blood pressure closer to lower blood pressure under 130/80, which is the goal for the patient with hypertension and diabetes according to JNC7. For the monitoring parameter, we check blood pressure in clinic 1 week, in 2 weeks, check lipid panel in 6 months following the start of the regimen, and discuss for the drug-related side effects. It has potential side effects of hypertension, angioedema, cough, hyperglycemia, hyperuricemia, hypertension, hepatotoxicity, fatigue, nausea, headache, and dizziness. For the patient counseling, we'll let her know to continue the same lisinopril hydrochlorothiazide for the same direction, which is 20/25 mg 1 cup POQD. And since it is treating the hypertension well, and discontinue the triamcinolone and loratadine since there are no therapeutic indications. And for lisinopril hydrochloride, we're going to educate the patient by letting her know that if she missed a dose, take the missed dose as soon as she remember. Skip the missed dose if it is almost time for the next dose. Do not take extra medicine to make up the missed dose. Store at the room temperature. If there is any side effects appear such as hypotension, angioedema, eye pain, visual problem, dry mouth, thirst, nausea, vomiting, feeling weak, drowsy, restless, or lightheaded, fast, or uneven heartbeat, muscle pain, let the doctor know or the clinic know. And for her diet recommendation, we're going to recommend the DASH diet, which is to avoid eating too much fatty acid, such as fast food, shrimp, fatty meals, whole milk. Eat a variety of foods such as vegetable, fruits, grains, and foods high in fiber, and restrict in sodium intake up to 3/4 teaspoon per day. And also, we're going to recommend her to increase the physical exercise such as brisk walking for at least 30 minutes a day, starting 3 days to up to 5 days a week. Start off by walking around the neighbor or doing yard work, etc. And also avoid drinking alcohol to 1 drink per day, which includes either 12 ounce beer or 5 ounce of wine, and reduce the use of tobacco, and also avoid caffeine, including energy drink, which can exacerbate hypertension and current medication. And we're going to provide information resource as www.heart.org and www.choosemyplay.com. Thank you.